For parents, few moments are more devastating than learning their child suffered a brain injury during birth, especially when they're later told it may have been preventable. Families often leave the hospital with unanswered questions, replaying the delivery, wondering what was missed, delayed, or ignored. In many Ohio birth injury cases, the answer comes down to one critical issue: fetal monitoring. What fetal monitoring is, and why it matters. Fetal monitoring tracks a baby's heart rate and oxygen levels during labor. When interpreted correctly, it gives providers time to intervene before permanent injury occurs. When monitoring is missed, misread, or ignored, oxygen deprivation can lead to hypoxic ischemic brain injury with lifelong consequences. Ohio hospitals follow national standards requiring timely recognition of abnormal fetal heart patterns, clear communication, escalation of care, and prompt intervention when distress persists. Monitoring is active, not passive, and applies to nurses, physicians, midwives, and hospitals as employers. Common monitoring failures. Recurring failures in Ohio cases include misreading fetal tracings, delayed responses to decelerations, failure to alert physicians, delayed cesarean sections, and inadequate staffing. When these errors allow oxygen deprivation to continue, permanent brain injury can result. So when do errors become malpractice? Not every bad outcome is malpractice. Under Ohio law, malpractice exists when a provider or hospital breaches the standard of care, and that breach causes injury. In monitoring cases, the key issue is whether timely intervention would have prevented the harm. Why do hospital system failures matter? Catastrophic birth injuries often result from system failures, not a single mistake. These cases frequently involve both individual provider negligence and institutional liability, where hospital policies, staffing, training, or communication systems contribute to unsafe conditions. Common institutional failures. Hospitals may be liable for outdated protocols, unsafe nurse-to-patient ratios, inadequate training, malfunctioning equipment, or communication breakdowns with no clear chain of command. These failures can prevent timely intervention, even when warning signs are present. Proving these cases in Ohio law requires expert testimony to establish the standard of care, how it was violated, and how it caused the injury. These cases demand deep investigation, including fetal monitoring strips, staffing records, protocols, and training documentation before filing. Let's talk about timing and damages. While Ohio allows extended filing time for minors, early investigation is critical because hospitals control evidence. Damages may include lifetime medical care, therapy, assistive technology, lost earning capacity, and pain and suffering related to catastrophic brain injury. These are some of the warning signs parents often notice. Parents often recall prolonged labor, repeated alarms, rushed staff, ignored concerns, or delayed cesarean sections. These red flags frequently indicate systemic breakdowns, not isolated errors, and warrant careful legal review. In closing, seeking answers after a birth injury is not about blame. It's about accountability and securing the resources your child will need for life. Fetal monitoring cases require sophisticated medical and legal analysis. Our team at Clark, Purdue, and List are experienced Ohio medical malpractice lawyers who can help determine whether preventable failures played a role. Visit their website at www.clarkpurdue.com. Thank you.